Back to the bumper breakfast. It's caring for the eyes, this segment and our health segment. Usually we focus on various things. Today we're looking at two areas, but we'll begin with the symptoms of eye problem. So how do you know you have an eye problem? That's the question we're answering this morning. I have the pleasure of welcoming an optometrist, Dr. Priscilla Imade.
Thank you very, very much. You made my job easier. You've explained what symptoms mean.
Good morning, good to have you here.
Thank you.
Dr. Priscilla Imade is an optometrist. She is a regular here, and it's been a while since she came back, to educate us a lot. I think the last year here was glaucoma week.
Yes, it was right.
The glaucoma month, yes, in March. All right, let's have it this morning.
Yeah, we just want to look at symptoms of eye problem. How do you know that you have an eye problem? Like she said, symptoms generally refer to your subjective feeling. That's the evidence that you have that points to the fact that there is a disease or a problem with your eyes. And some of these symptoms is what we are going to look at this morning. The first one I want us to consider is what we call eye fatigue. Anytime you're doing some work with your eyes, whether reading, driving, or doing any of your occupational jobs, and your eyes always feel tired, just know that there could be a visual problem that you need to attend to. Another symptom is redness. You find out that some people, repeatedly, their eyes are getting red. It may clear off after a day or two. Before you know it, after maybe a week or two, the redness comes back. While there are some people, the redness may even be permanently on. If you keep experiencing redness in the eye, it's a sign and a symptom that something is going wrong with your eyes that you need to treat. There are quite a number of eye problems that can make your eyes red. Many people always equate redness with Apollo. It is not all red eye that is Apollo. I have seen people go blind from just the eye being red, and they ignored it. By the time they came to the clinic, we discovered that it was something more serious.
Or they did self-medication and all that.
We are coming to that as part of the solution. You don't need to do self-medication when it comes to treating the eyes. A lot of people get it wrong when they do that. Apart from redness, the eyes can also be watery. You just find out that, when you say as you're reading, your eyes are bringing out tears. It's not supposed to be. And sometimes you're driving on the road, as you're on the express, you just notice that your eye feels watery. That's not a good a sign for you to consider about the eyes. So it's an indication that there is something wrong with the eye. Mind you, any symptom you feel as an individual, as you are using your eye, it's more or less like the way that the eye is complaining to you
that something is
wrong. It wants your attention. It wants you to look at it. So your eye can be red, your eye can be watery, your eye can be tired. You could have what we call gritty sensation. Sometimes you just feel like there's sand in the eye. You are trying to blink, it looks like there's something in the eye. And then that could lead to you scratching the eye. You start rubbing, you just start, and some people even say, oh doctor, when I'm scratching my eye, the thing is sweet. I feel so comfortable, and I want to do it. And when I start doing it, I'm always scratching.
It's sweet. So scratching your eye is sweet.
So when you do that, actually, it's wrong, and it's an indication that you should go and check your eyes. Eye pain is another one. You feel pain, whether inside the eye, around the eye, even on the head, it's an indication that something severe could be going wrong in your eyes that require attention. Some people too, they squint to see. They want to look at what is far. Maybe someone is greeting them from afar, they don't see, so they have to squint. Or they want to read from the board, they have to squint. When we say squint, that means you are closing your eyes to see. You are trying to, limit.
Maybe like you want to
something like that to see.
How do you see when you squint? I can barely see anybody.
That's because maybe your eyes are good. For people who have a visual complaint, when they squint, they tend to see better. Because when you squint, it gives you what we call a pinhole effect that enables the concept of shots of excessive light that may be disturbing your vision. Because you don't have the problem. Those that have the problem will obviously do better. And then blurry vision. Whenever you are looking at something that is far from you and you cannot see that thing very well, maybe you are looking at someone's face, you can't even recognize the person. You know, there are quite a number of people like that. When people are far, they'll be greeting them, they won't see the person, they won't recognize the person, or the person comes close. I've had someone tell me that, oh doctor, my friend feels I'm a snob, they think I don't want to greet. You don't know that once they are far, I don't see them, I don't even know that they are the one until they come close. So if you're having difficulty seeing someone far from you, it's an indication that there's a problem. And then when you want to read, tiny prints like this, you can't see it, you can't read, it means there's a problem. Or you are reading, you have to use your hand to push the book so far from you before you can see it. It's a symptom that something could be wrong in your eye. If you see double, practicing. If you see things as double or blurry, or if at any form of visual discomfort at all that you can't even explain, please just know that that's an eye symptom and it's pointing you towards a check for the eye. Quickly, what are the solutions? If you are experiencing any of these symptoms, or even the ones I have not talked about, but you just feel funny with your eyes,
you just know something is not right somewhere,
please seek your optometrist. Go for an eye examination. We're talking about self-medication a while ago. What I have experienced in my practice, I've been practicing optometry for over 2 decades. I have noticed that people will rarely take the initiative to come for an eye examination until they have tried home-tested remedies. They have asked Tomison, hey, when your eye was paining you the last time, which eye drop did you put? They will now, they will try all sorts. When it did not work, that's when they will start looking for the optometrist. This is not how the eye works, and that's not what it should be. Please, your first port of call when it comes to the eye is your eye doctor. Go for an eye examination. You know why?
Can insurance afford it?
Why not? If you say seeing is expensive, try blindness. Exactly.
You can practicalize.
Close your eyes. Just try to walk about for 30 minutes and see. Try to pick the colors of your shirt. It's not an option. Blindness is not an option at all. And what many people don't know about the eyes is that the eye can gradually be going blind without you knowing. You might just feel, oh, okay, I can still see and all that. And at the end of the day, you may have lost so much vision that there's little or nothing the doctor can do about your
That's
situation. Why you must seek your optometrist first. Make sure every year at least have an eye examination. And eye examination doesn't have to do with just symptoms. You may not even feel symptoms because there are some eye problems that will not give you symptoms, like glaucoma. We talked about it the last time. No symptoms. And I've seen several people go blind from glaucoma when there was no symptom. So please, your first port of call, if you feel funny, you have any feeling, any symptom about the eye you can't explain, see your optometrist. And then avoid self-medication. Please don't do that. I had the case of a mother who applied potash.
Shouldn't they even ban pharmacists, from chemists from selling eye?
Those, they have their regulatory agencies.
Unless
there are drugs that are on prescription. Yes.
Okay.
But you still find out that people abuse these privileges. So please, what I'm saying is this. Don't put anything in your eye that is not prescribed by your optometrist. For instance, somebody that is putting herbs, is it a pharmacist that will recommend that one? I was just going to say that there was a mother that applied potash on the eyes of her son.
What is potash?
Count. The child had red eyes. He was having redness. The eye was red. And we now said put potash inside water. Then put the water. And she was actually putting it.
Did you put it back to my own eyes?
And eventually, that potash was too harsh on the eye. It eroded the cornea. So please, these are self-medication.
Can the boy still see?
Well, eventually ended up, upgrading the cornea and losing the cornea. But then, it's a lesson for every one of us to learn. Haven't you seen people putting urine in the eye? You've heard. Have you not heard of drivers that say they put petrol in the eye? Yeah, I've seen. They say, doctor, I just put fuel in the eye. Everything
cleared up.
Yes, these are self-medications. We don't advise that. The eye is very delicate. Anything that is too harsh for the eye, the eye cannot cope.
The fact that we can come up with so much self-inflicted pain.
Exactly.
Because I can just imagine how much pain it would cost you to put petrol
in the eye.
It's going to be really painful.
So many things.
Why do you go through so much pain while damaging your body?
I don't know. So many. So sometimes it beats my imagination.
It comes to the reason why people are also going to do quack, bum enlargement, and breasts. Okay, they don't even do breast again. It's bum enlargement. Quack, bum enlargement, and then the thing will now burst. It was in the news yesterday. It's not me.
I don't know.
It was in the news yesterday. I don't understand how you people are doing it. Just go and eat plenty food. If you want to be fat, be fat. If there's no bum in your lineage, I don't know why you want to have bum back. Go on.
That's medication, and it's not good. It is wrong.
Medication too now.
Please, let's do the right thing.
You know that all of your aunties, all of the women in your family don't have bum. You know. It is not a matter of a lie. You know. And then you wake up in the morning, you put bum, you put it by force, and then you want to do it. You're not even going to the right set of people.
That's what we are trying to correct. That's the narrative.
Only 5
we
people.
Want people to seek out professionals. Please, when it comes to the eyes, there is no substitute to eyes. These 2 eyes, if you lose them, you can never have another pair. If you lose your hand, you can do a prosthesis and you still manage it.
Hold on, are they doing eye transplants?
Not that I know of.
So, okay, in your 20 years of being an optometrist, you have not seen eye transplant being done.
I've not seen anything like that. Once the eye is lost, it's lost. So why can't you preserve these 2 eyes that God has given you? It is with the eyes you appreciate the beauty of the world. I mean, if you really want to appreciate God, you need to have eyes to see. So please, preserve this your eyes. Another thing you can do is eat healthy. Eat healthy. If you want your eyes to be okay, you don't want all these symptoms you're talking about. Eat healthy. Vitamins. A lot of the luteins, the zeaxanthins, the omega-3, the vitamin A, the vitamin B, vitamin C, and all of them.
Make them
part
in
of
food
the
or drugs.
In food. Things like salads. Our local food. You know they are very rich. You know how many vitamins that are there? You can even believe.
But they put potash inside it too. There's some people touch inside it.
Anyway, that's when you cook it and you eat. You can even squeeze it and drink, and you have all the vitamins, of course. So these are very, very good. Greens, anything green, anything fruity is good for the eye. Carrot, you can just juice your carrot and then you drink the water, which is good. Instead of doing carbonated drinks every time, or even doing alcohol. Alcohol is not good for the eyes. Cigarette smoking is not good for the eyes. They predispose you to things like cataracts and other forms of eye problems.
Cigarettes affect the eyes.
Of course. Alcohol
affects the eyes.
Instead of drinking alcohol, drink water. Water is very, very good.
Well, it does not mean
the human body is made up of about 70% water.
Water does not make people happy.
The eye has about 60 to 70% water. So water is good.
For the
take
body.
a lot of water. You can exercise regularly and then sleep well. And if you don't sleep well in this Lagos, the eye that you used to sleep now, when
if you live in Ikorodu and you work in Lekki, your lifespan, you can just calculate it yourself.
Sleep well. Sleep is the instrument of God to revitalize your health, to revitalize your body. And the eye is not in isolation. The eye is part of your body. When you sleep and you rest the eye very well, there are quite a number of these symptoms that we just reduce drastically.
By itself.
Yes. So it's good.
All right, our doctor is here this morning, and you can call her for more questions. You can also reach out to her, and if you have issues, she has a hospital you can always go to. Please give people your number so that I can talk to the family.
Okay, well, you can always call me for all your questions. 080 33 33 6672.
That's 080 3333 6672. So if you have an eye problem, don't call Tomisin. Tomisin is not a doctor. Tomisin is a talkative. He talks for a living. She's the doctor. 08033336672. Thank you so much, Dr. Priscilla, for being here with us this morning. All right, I did say coming up next is still health, and I have Sammy in the studio. I'm so excited this morning. Let's go.